Sure. Pete, 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 Pete. Got an echo from somewhere. Oh, it may be.
camera. I don't know if it's going to be zoomed in enough. Okay, we're going to get started in just a second. So for all the media who have called in, we want you to be on mute during the remarks, just because the mics are very sensitive, and if you make any noise, it's going to bounce around and then you won't be able to hear. So if you have questions as you go throughout, I encourage you to use the chat function in Zoom if you're on a device that has that. I know it's hard to see, but if you kind of mouse down to the bottom of the screen, there's a little button that says chat, you hit it. Darnell and I have both added a couple of questions in there, but as the remarks are going on, if you have questions and you don't want to wait till the very end, just put them in the chat. I'm going to be monitoring this. If you are not on a device that lets you actually type a question, if you're like listening via a phone call, you can also text my cell phone number. It's on the media advisory, but the number is 606-782-7735. You can text it to me. I will add it to the list of questions, and we'll make sure that they get addressed. Otherwise, at the very end, when we're kind of done with each section of remarks, we will open up the floor to questions. But to keep everyone from talking over each other, if you wouldn't mind to, well, I know a lot of people don't have your video turned on. If you can turn your video on, please turn it on, because we want people to kind of raise your hand so I can see that you have a question. We can kind of call on you, and then you can ask it and then go back on mute. Does that make sense? Okay. All right, I'm monitoring questions. Jay is going to get us started. So, ready?
Good morning, everyone. I'm Jay Blanton with UK Public Relations. I'm glad you could be with us this morning. In keeping with the social distancing and health measures recommended by the federal government and Governor Beshear, we wanted to hold today's briefing through Zoom and on Facebook Live. We appreciate everyone who is participating. This is our first time conducting a briefing entirely in these kinds of formats, so we ask for your patience. We will, I'm sure, have some hiccups. I also suspect we're going to have opportunities for more practice at this, so thank you and appreciate you being with us. As we've done before, I want to provide some campus updates on initiatives that President Eli Capilouto has communicated with our campus about actually just moments ago. And I'll walk through the details of those with you and then take questions about campus issues and initiatives that we've undertaken. A couple of our key campus experts are actually online with us today as well. If I stray too far away from my talking points or if we venture into anything approaching math, they'll be there to help me. Then, after we take questions on those campus issues, Dr. Mark Newman, who is our Executive Vice President for Health Affairs, will discuss a major initiative that UK Healthcare will commence with immediately in response to this public health crisis. And then we'll quickly pivot to some updates on our ongoing response to and preparedness for COVID-19. And in that, we'll be joined by Dr. Alice Thornton, Chief of our Division of Infectious Diseases, and Kim Blanton, Enterprise Director for Infection and Control within that division. And we'll then, after they speak, take questions for our healthcare professionals. So, first, I've got 3 quick campus updates that I'll try and run through quickly and take your questions on. First, President Capilouto today announced that all instruction for summer 2020 will move to online or remote learning formats. 2, next week the university will begin providing prorated financial credits to students for housing and dining plans that will be applied to student accounts as a credit for spring term charges. So each eligible student who receives this credit adjustment and enrolls in the fall 2020 semester also will receive $125 in dining flex dollars to be used in that semester. And for those of you who don't know that terminology, flex is sort of like a debit card on campus that can be accepted and used at all UK dining facilities. Finally, we'll have a similar sort of prorated credit plan that will be offered to students for parking permits as well. So a few details about each, and then we'll move on to Dr. Newman. So with respect to summer classes going to remote formats, the move is necessary now to provide time for faculty and support staff to make the transition to online learning and to give students and families appropriate advance notice so they can make plans as well. While other details are still being hammered out, other programming for this summer that is very important to us, such as our orientation sessions and initiatives that help prepare some of our students for college life, they also will utilize online or virtual programming this summer. We'll be directly in touch with students and families about those initiatives as we work out those details. So by way of a little background, summer courses for the university begin on May 11th. Between now and then, faculty and our support staff will be transitioning some 350 course sections to online or remote formats. And as I mentioned, we also offer several what we call bridge programs that help ease the transition for new students to college life, and our orientation sessions, what we call See Blue U, that occur during much of the month of June and July. Those will all be conducted remotely as well. Given the emergency and one-time nature of this transition with summer school, differential tuition for summer online courses will be suspended. For undergraduate courses this summer, UK will charge $499 per credit hour for tuition and fees. This rate change is subject to UK board approval. It will apply to both residents and non-residents. You may recall, some of you, that last spring we announced a very significant expansion of online course offerings, and as part of that we announced that we would charge one tuition rate for undergraduate students taking a mix of online and in-person classes, and a different rate for students taking only online courses, regardless of their residency. So we're suspending that differential rate for this sort of emergency situation this summer. Housing and dining. Students who moved from UK housing by March 27th, which was the date we had set to try to ask our students to move back to their permanent residences, they will receive a prorated credit for housing and meal plan costs for the rest of the semester. So that's basically 36% of the spring 2020 costs for housing and dining. That's a 36% non-refundable credit. It will be posted to student accounts beginning April 6th. Specific credit amounts will be determined by the individual student's room type, what kind of room situation they had, and the meal plan that they had. The credit will be first applied to any outstanding balance a student may have, and can be applied to summer 2020 or to fall 2020 tuition, housing, dining, or mandatory fees. If the student does not return for the fall, the student can receive a refund in September. Graduating students who have incurred these costs for housing and dining, a much smaller number, will receive a refund in June. Information about these credits will be posted on what we call My UK, which is the portal that UK students can access online. Students and families also will be receiving additional information about the housing and dining credits shortly. We hope that by applying these credits to the spring term, we can provide some level of support that will help ensure students and families can continue their educational progress and success with us. Finally, on parking, students who purchased parking permits for the 2019-2020 academic year or the spring 2020 semester and no longer need access to campus may return their permit to receive a similar sort of prorated credit. Credits will first be applied to any outstanding parking citations associated with the student's parking account, and any remaining balance will be credited to the student's university billing account. To be eligible for a credit, students must return their parking permit along with a completed request for student parking permit credit form to our Office of Transportation Services by May 1st. You can get complete details and forms and instructions on that on the Transportation Services website. As always, our guiding principle in all these decisions has been and remains to ensure the health, the safety, and the well-being of everyone in our community and those who are about to, we hope, proudly join this community. Moving our summer courses online, for example, is where we need to be to honor that principle. As President Capilouto has often said, our faculty and staff have risen to every challenge this unprecedented crisis has presented, working in partnership with each other, our students, and with those families and loved ones who support them. We think these initiatives reflect that commitment and that continued work for our students and those we serve. I'm going to be happy to take any questions about this now. Online with us is also Dr. Kirsten Turner, who is Associate Provost for Academic and Student Affairs, and Penny Cox, who's an Associate Vice President at the university and our Acting Treasurer, and who oversee much of our summer school programming and our housing and dining plans. So with that, let me stop and see what questions we have specific to those issues before moving on to our healthcare professionals. Okay, we can always come back. I think I'm pretty easy to reach to afterward if we have additional questions. I think some news releases went out a few minutes ago, and the President has communicated all these decisions to our campus this morning. So now, with that, I'd like to ask Dr. Mark Newman, our Executive Vice President for Health Affairs, to come forward. Dr. Newman.
Thanks, Jay. So, appreciate all of y'all being here with us today. I want to start off my comments, as I usually do, by thanking our staff, our faculty, all of our healthcare givers, everyone throughout our healthcare institution for their resiliency and compassion as we move through what is an unprecedented period in healthcare and in our country's history. The other thing I want to say, and I always start by saying, is to our patients, despite this unprecedented crisis, we are here for you. We and the great people that I just talked about are here to take care of all of our patients and make sure we have the healthiest Commonwealth we can. Today, I'm going to talk about the next step as we try to ensure preparedness for what I again described as our challenges ahead. Let me reiterate that being prepared, taking care of the state, is at the core of why UK healthcare exists, for the state and for its amazing people. Now, as we look at COVID-19, the model and the trajectory of those models vary regarding the scope and the depth of the surge, the timing of when that peak may occur, as well as the impacts on the bed and the capacity of ICUs and ventilators within the state. The real timing depends on how much we flatten the curve, specifically social distancing, which we want to continue to encourage, and other health measures that can take hold to reduce our peak. Let me again commend the Governor and our Commissioner of Public Health for their aggressive stances to protect the Commonwealth. We have been working internally for weeks on models and scenarios mapping to be prepared to handle the critical care needs of our community and region, no matter what the extent. The next element in our planning has revolved around the need to stand up a field hospital. Should we need the beds and the health services, if that arises, we want to be prepared to meet the challenges that the virus presents. We are still working through the details of this plan, but have advanced far enough in our efforts that we thought it was important that we communicate now exactly where we are. Let me briefly describe some of the specific elements of our plan. First, we wanted scale. We will be opening a turnkey, temporary medical facility to accommodate 400 patients. We needed that scale, the ability to be able to respond to potentially worst-case scenarios. The field hospital will be established in Nutter Fieldhouse on the UK campus. I want to thank our great athletic director, Mitch Barnhart, for his constant support, but especially for their support over the last few weeks. The field house will have a number of things, and I'll read off a couple of those things. Approximately 400 partitioned medical rooms. Again, it's a standard subflooring floor system, nursing stations, heavy-duty cots, dedicated break rooms. Again, because of what we see with the COVID-19 virus, separated nebulizing stations to be able to treat these patients. Linen, shower units, so this is a turnkey. They bring this into us. Shower units with daily sanitation, again, daily towel service, restroom units, all the things that you would need to stand up a 400-bed hospital, as well as the potable water and all the food services, shower, and restrooms that we would need as a part of this. So again, a turnkey system to be able to move forward in what we are going to see as a facility that we hope that we don't need. This kind of planning and preparation speaks to our mission as the state's largest healthcare provider and our responsibility to the critical needs of the state of Kentucky. I've been doing, again, a number of, community discussions, if you will, forums. And one of the things I tell them at the end each time is this is who we are. This is what we do. And we look forward to being able to meet the needs of the state of Kentucky. Thank you.
Before we take questions for Dr. Newman, I wanted to bring up Dr. Alice Thornton and Kim Blanton to give just sort of, as we've done before, some general updates on COVID-19 and our response.
All right. Good morning. I will start with just giving you some of our normal numbers and let you know where we are from a situation inside UK Healthcare. As of this morning, we have 8 inpatients that have tested positive for the COVID-19. We have a total, since we began this journey at the 1st of March, a total of 74 positive test results back, and we have performed 2,031 tests. This morning, we also are monitoring 10 pending test results, and that can be from inpatients or from some of our emergency departments and our ambulatory care areas. Normally, we talk about our situation with vents. I know that's always a question, so I want to make sure we address that. This morning, we have 178 vents that are available for use, and only 52 patients that are on vents today. And so we're constantly reevaluating that as well.
Thank you, everyone, for letting us join you today. Please don't worry, Dr. Forrester does not have COVID. He's taking a much-needed day off with his family, and I'm trying to pinch hit for him. I just wanted to make sure that people understand where we are in Kentucky. I have friends all the way from the West Coast to the East Coast, and when I tell them, when they see what the state of Kentucky has done and what the University of Kentucky has done, University of Louisville, Norton, Northern Kentucky, our partners across the state, they can't believe it. They are impressed with how transparent we're being and how proactive. And so it may not feel like it, but we are really in a good place, even though it's very scary. When I talk to other people, they really feel like it's very cohesive in the state of Kentucky. So I just want to encourage people with that, even though you may not feel that way. We really, I think, are being very proactive, which is the stance that we should take. And I just want to point out also to remind people that we are a state with a lot of providers here. We have infectious disease providers, not just doctors, but APPs and a lot of other people. We have pulmonologists, we have intensivists, we have several large institutions that have those folks here. We have smaller hospitals that are also staffed with really competent people. And we are a rural state with a couple of bigger cities, but we're used to working together as a state. We already do a lot of phone calls with our partners. We're already doing telehealth with our partners. So I think as a state, we're prepared. Does it scare me? Yes, it does. But we got this. And the thing that we have to do is keep our wits about us, be logical, and use your common sense. If there's one, I'm originally from West Virginia, and if there's one thing about West Virginians and Kentuckians and rural people is we have common sense. Dig in, find that common sense, and use it. Don't panic. We can do this if we work together. And I just want to make another point, and then we can, take questions or whatever, that we are used to being a very clinic-centric, hospital-centric community. If we have a cold or we have something going on, we run to the clinic or we run to the emergency room or we run to the hospital. We've got to think about this different. I really think our governor has it right. Social distancing is so important. And so we're going to have to do phone calls with your providers. We're going to have to do telemedicine with your providers. And we got to think about being that hunker down at home and working from that standpoint. So I'll go ahead and let Kim or wherever we are next on that.
I think now we're going to open it up to questions for Dr. Newman and Dr. Thornton and Kim Blanton.
Can we go ahead and ask a few that have been coming in? Test. So we had a few questions come in. This one's probably for Dr. Thornton or Kim. What are your views on healthy citizens wearing protective masks in public?
Well, I think that's a great question and one that Kim and Derek and I have been wrangling with all week. And I think that we view masks as another tool in our toolbox. And that includes our citizens if that ends up being the situation where they have them. But definitely our frontline staff and our providers, obviously, they are the folks that are going to need these masks the most, not just for our protection, but for your protection as a potential patient. And I think of it as a tool in the toolbox. Think first about social distancing. Think first about staying home unless you absolutely have to be out. I think those are your big tools, and then this is a smaller tool that you can use. I don't know if that answers the question, but that would be my view.
This was for you or for Kim. What is the role of a ventilator for a coronavirus patient with underlying health conditions compared to using it for an infected patient who is considered healthy?
So I'm not quite sure where the person is getting with that, but I think we're going to continue to take care of our citizens in the Commonwealth just like we always have. And I think I can speak for all the infectious disease providers and pulmonologists throughout the state. If you're an individual in the state of Kentucky and you have COVID or you don't have COVID and you need to be ventilated, we are going to use everything we can to make sure that you get the care that you need. And I think Dr. Newman has really done that. I think the other places that I'm aware of, they're doing the same thing. So I think no matter where you find yourself in Kentucky, you're going to have dedicated people making sure you get the care that you need, whether you're COVID positive or COVID negative. And I think that brings what I'm saying is let's think about being not clinic-centric and not hospital-centric, but home-centric. So as much as you can, stay at home, do telemedicine, do telephone calls, unless you need to be in a hospital or a clinic.
Another for Kim or Dr. Thornton. Is it still a question as to whether there will be a decrease in the spread of COVID this summer?
Thanks, Kim. So I think that to look at that, I would definitely think about some of the news that you may have seen by Tony Fauci, who's an amazing infectious disease person. And I think what people probably will expect is that whichever state that you're in, you're definitely going to have a peak. And where that happens will depend on, how far into the summer we are. But then there'll probably be another little bump or blip or something like that as when we finally get to the point that we can start emerging into society. So I hope that answered that. Definitely, though, sorry to be a broken record, but staying at home, social distancing, being smart, washing your hands, doing all those things, I think are going to get us closer to that flattened curve than anything we can do.
You might be able to handle this one. So currently there are 8 people with COVID occupying beds at UK, correct? And how many beds does the hospital have?
So we have, on regular routine, we have about 945 beds. We can surge to over 1,200 adult beds, and we can surge to almost double our ICU capacity. So I think we have plenty of beds, and again, because of what we've done to reduce the elective procedures, our volumes across the state are substantially down now compared to what we would have at the same period of time. That creates all kinds of capacity, which is the goal of the plan that has been in place. And I think that's an important thing for people to realize is that we're ready to start to look at that surge. We're ready to prepare for it. We have, I think, 2 or 3 more weeks to be getting ready for it, but we're ready for moving into that surge.
For Dr. Newman, is the field hospital in response to Governor Beshear getting one ready in Louisville at the fairgrounds?
No, we've been working on this for some time. I think part of this is that as we got to looking at the different models and thinking about the opportunities, the concern is that as these started to come up, we were going to lose the opportunity pretty soon to be able to find a vendor that could do this for us. And so we knew that we felt that we needed it, and so we just went ahead and made that decision. I think it'll probably take a couple of weeks for it to be up and ready to go. And I think the other piece is that we wanted to be able to work, prepare, and train for its use before we needed it. I think that's the whole idea of preparedness, is be able to train and get ready for this so that when it hits, we're ready to respond.
Is there any concern with having enough staff for the field hospital?
I think there's always concern about having enough staff when you're in a pandemic. I think for us, one of the things that we will do when we get to that eventual surge, we will probably be looking at, again, a staffing plan that includes a lot of people that would normally be working in our ambulatory side of the equation. And I will say the other part of this is it's meant to be a lower acuity capability for us to be able to move patients through our hospital and have them there before they go home or before they go to another facility. During an emergency like this or a crisis like this, throughput through the hospital is important. And so we're going to be working with our partners across the state. We're already setting up a single call center to be able to help manage that flow. And as a part of that, then that's a key part. But again, the ability to manage patient throughput is important to our success.
That's all the written questions that have come in to me so far.
Okay, I think that's all our questions. If there aren't any more, we'll close out, and appreciate everyone participating today and working with us through this new format. I know we'll be back for updates in the near term. Thank you very much.